Danielle, and today I'll be showing how to do sterile suctioning. So a couple indications for sterile suctioning is to maintain a patent airway, to help mobilize the pulmonary secretions out, and if you need to obtain a sputum sample, this is a way that you can do that to rule out any pneumonia or any pulmonary infections. So some contraindications would be hemodynamically unstable patients and patients who have high cranial pressure. Some hazards or complications would be atelectasis, bronchospasm, hypoxemia or hypoxia, the vasovagal response, excess coughing or vomiting. And before you go into the patient's room, you would just want to go ahead and go over the patient's chart, see any significant findings. You can also see what the patient's trach size is. You would always want to verify on the patient and make sure that they have the right trach size at bedside. So to get the proper catheter size, you would go ahead and check the trach size, and you would multiply that by 2 and then go down a French catheter size. So for this patient, he has a size 6 trachea, so you would times that by 2, which is 12, so you would get a 10 French catheter. So you can go into the patient's room after you get your sterile suctioning equipment, and you make sure you have your stethoscope and your pulse ox. So you go ahead and sanitize your hands. Put on some gloves. So you can go ahead and go in the patient's room. Hi, my name is Danielle. I'm a student from the respiratory department. Can I get your first and last name and your date of birth? And then you also want to verify by the patient's wristband. And so you want to explain what you're doing in the procedure. So you want to explain to them that you're going here to suction them. So you would be sticking or putting a catheter down their trach site, and then you would help mobilize their secretions. So before you start your procedure, you would also want to make sure that their arburator is hanging on their bedside, in case the trach were to come out, you can go ahead and use that to push it back in. You also want to verify the trach size. So with this patient, he did have the size 6 trach, and you want to make sure that there's an extra one at bedside as well. So you want to make sure that there is an ambu bag in the room, as well as having a mask. You want to go ahead and check the ambu bag to make sure that it is working. So you would go ahead and check if the duckbill was open and closing. You would go ahead and occlude the top and squeeze to make sure that the pressure is staying. You would also squeeze the bag, occlude the valve, and then make sure that the bag refills. So you would want to make sure there's a face mask, or bring a face mask just in case the airway was occluded. Then you would just cover the stoma site, and you can just bag the patient via face mask. So after that, you would also want to pre-oxygenate your patient as well. So you can dispose of these ones because you will be using sterile gloves. So you can go ahead and fill your sterile water box with sterile water to go ahead and clean the hose after you are done. So you go ahead and put the sterile gloves on. So you can go ahead and choose a sterile hand and a dirty hand, or just clean hand. So this will be my sterile hand. Go ahead and grab the bag, hook it up to the vacuum. Go ahead, and you want to just make sure that you are only touching the catheter with your sterile hand. So after you pre-oxygenate, you go ahead and take the patient off the whatever oxygen device or ventilator they're on. You would want to make sure that the patient is always still stable. The patient hasn't decided or anything. And then you would want to make sure you're telling the patient every time you are going down the trach. So there, I'm going to go ahead and start suction use. I'm going to go ahead and insert my catheter. You want to make sure that it's straight and it's not occluded. And you would also want to be doing this within 10 to 15 seconds. So you go down, feel resistance. You want to pull back at least a centimeter, and then as you're pulling out, you want to pull out in a circular motion and intermittently squeezing or occluding the vacuum. So after you go through the first run, make sure your patient is always stable and he's doing okay. You can then ask the patient if he wants to be suctioned again, or you can reassess, re-auscultate, and see if the crackles or bronchi have cleared up. Or if they haven't, you can go ahead and suction again. But with this patient, he's okay. We're going to go ahead and just stop the suctioning there. So you can go ahead and dispose of this. You would also want to post-oxygenate the patient. Go ahead and get rid of the catheter and your gloves. You can just reapply new gloves. So after the procedure, you would also want to post-oxygenate. You can put them back onto their oxygen source or put them back onto the ventilator. You can also clean the suctioning line with your sterile water. Make sure that's clean and nothing gets stuck in here. So then you would also make sure that the patient is still stable. His SpO2 didn't drop yet, so pulse ox is still on. You would auscultate again. So the patient sounds clear, so we got all the secretions. You want to make sure that your patient is still doing okay. Ask them if they need anything. Make sure the call light is within reach. Let them know that if they need anything, just to call the nurse station for the RT or anything like that. Go ahead and put that away. So a couple of things, the difference between the length size for suctioning via endotracheal tube or just the trach. The trach is a shorter distance because the endotracheal tube you are going through their upper airways. So then after the patient is doing okay, you can go ahead and leave the room. Dispose of your gloves. Go ahead and use your hand sanitizer. Get rid of all your equipment. You can dispose of it. Then you would want to go ahead and chart any significant findings. If you were able to obtain sputum, you would also want to chart the COCA, the color,